What if I told you that losing your hair is not the real problem, but believing there's no solution is? Every day, millions of men and women look in the mirror and feel less confident because of hair loss. But today, we're breaking the myths, fears, and confusion around hair transplant and showing you what really works. Stay with me because this video could change how you see yourself forever. Why this matters. Welcome back to Balanced Motion Health, the channel where science meets real-life solutions for your body, confidence, and long-term wellness. Hair loss isn't just a cosmetic issue. It affects confidence, self-image, and even how people interact socially and professionally. And if you're watching this, chances are you're losing hair. You're thinking about a hair transplant, or you simply want honest, medical-based information before making a big decision. Today, I'll walk you through everything you need to know, clearly, simply, and honestly. Section 1. What is a hair transplant? Simple explanation. Let's start with the basics. A hair transplant is a medical procedure where hair follicles are taken from areas of your scalp that are genetically resistant to hair loss, usually the back or sides, and transplanted into areas where hair is thinning or completely gone. Here's the key point most people don't understand. The transplanted hair keeps its original genetic resistance to hair loss. That's why hair transplants can be permanent. This is not artificial hair. This is your own natural hair, just relocated strategically. Now that you understand what a hair transplant is, let's talk about why people lose hair in the first place. Section 2. Why does hair loss happen? Hair loss happens for many reasons, but the most common one is androgenetic alopecia, also known as male or female pattern baldness. This happens because certain hair follicles are sensitive to a hormone called DHT. Over time, DHT shrinks the hair follicles until they stop producing visible hair. Other causes include stress, hormonal imbalances, medical conditions, nutritional deficiencies, poor scalp health. But here's the truth. A hair transplant only works best when the hair loss pattern is stable or predictable. That's why professional evaluation is critical. Section 3. Types of hair transplant procedures. Not all hair transplants are the same. Let's break down the main methods in simple terms. 1. FUT strip method. A strip of scalp is removed from the donor area. Hair follicles are extracted and implanted. Leaves a linear scar. This method is older and less common today, but still effective in some cases. 2. FUE follicular unit extraction. Individual hair follicles are extracted one by one. No long scar. Faster healing. More natural results. FUE is currently the most popular hair transplant technique worldwide. 3. DHI direct hair implantation. Advanced form of FUE uses a special implantation pen, more precise placement, higher density in skilled hands. Each method has pros and cons, and the best one depends on your scalp, hair type, and goals. Now let's address the question everyone asks but few people answer honestly. Section 4. Does a hair transplant really work? Short answer, yes, but only when done correctly. A successful hair transplant depends on surgeon experience, proper planning, correct hairline design, good donor area, patient expectations. Here's the reality. A hair transplant is not magic. It doesn't give you teenage-level density overnight. Results take time. But when done right, natural appearance, permanent hair growth, improved confidence, life-changing results. Section 5. The hair transplant timeline. What to expect. Let's walk through the realistic timeline. First 2 weeks, mild redness, scabbing, temporary shedding, this is normal. 1 to 3 months. Transplanted hair may fall out. This is called shock loss. Follicles are still alive under the skin. 3 to 6 months. New hair begins to grow. Thin at first, gradually thickens. 9 to 12 months. Visible density, natural growth pattern. Final results start showing. Patience is not optional, it's required. Transition. But before you rush to book a clinic, there are things you must consider. Section 6. Who is a good candidate for a hair transplant? You may be a good candidate if you have stable hair loss, you have sufficient donor hair, you are in good general health, you have realistic expectations. You may not be ideal if hair loss is aggressive and ongoing, donor area is weak, underlying medical conditions are untreated. A good clinic will evaluate you carefully, not rush you into surgery. Section 7. Risks and side effects. Honest talk. Every medical procedure has risks. Possible side effects include temporary swelling, redness, itching, infection, rare with proper care, poor results if done by unqualified clinics. This is why choosing the right surgeon matters more than price. Cheap hair transplants often become expensive mistakes. Section 8. Story time. A realistic patient experience. Let me tell you a story. Ahmed was 32 years old, successful career, healthy lifestyle, but severe hair loss destroyed his confidence. He avoided photos, wore hats everywhere, felt older than his age. After months of research, he chose a qualified clinic, not the cheapest option. The first 3 months were frustrating, no visible change. Doubt crept in. But by month 8, people started asking, "Did you change something?" By month 12, natural hairline, fuller crown, confidence restored. Ahmed didn't just get hair, he got himself back. Transition. So now the big question. Section 9. Is a hair transplant worth it? If you value long-term results, want a permanent solution, are ready to commit to proper care, then yes, a hair transplant can be worth it. But remember, this is not about vanity. It's about confidence, identity, and mental well-being. Section 10. How to maintain results after a hair transplant. Your responsibility doesn't end after surgery. Post-transplant care includes following medical instructions, gentle scalp care, healthy nutrition, stress management, sometimes medications like minoxidil or finasteride, doctor-guided. Balanced health equals better hair results. If this video helped you understand hair transplant in a clear and honest way, like this video to support balanced, evidence-based health content. Subscribe to Balanced Motion Health for trusted wellness education. Comment below. Are you considering a hair transplant or are you still unsure? Your question might help someone else watching right now. Remember, confidence starts with knowledge, not fear. See you in the next video.